All right. Hello, everyone. I see folks still trickling in, but I'm going to go ahead and get us started. Welcome, everyone, to today's webinar, Transforming School Medicaid Lessons from Illinois. It's so great to see so many people joining in today. My name is Jessie Mandel, and I'm the National Program Director at Healthy Schools Campaign, and I have the pleasure of kicking off our webinar today. Now, before I review our agenda for the day, I want to mention a few housekeeping items. First, this webinar is being recorded, and we will email out the recording, slides, and additional resources after. Also, you can submit your questions at any time. You can ask questions to the speakers through the Q&A or share questions or comments to all participants through the chat feature. We'll do our best to answer all questions, and if we don't get to a question today, we'll follow up with you after the webinar. And finally, a note, I'm sure many of you have seen that FEMA will be conducting a nationwide test of the wireless emergency alert system today at 1:20. Just in case you were nodding off, this will keep you all on your toes. All cell phones will receive an alert, including loud alarms between 1:20 and 2 p.m. Central. And the alarm will sound even if your device is in silent mode. So please note that some of our presenters have their phones with them in case any tech issues arise. So we apologize in advance if anyone hears an alarm in the background. So with that, now I'll turn to today's agenda and briefly introduce today's speakers. First, I will provide some general overview and background about school Medicaid and recent federal opportunities. Then I'll turn things over to Kate Yeager, Director of Medicaid for Chicago Public Schools, or CPS, to discuss Illinois' path to Medicaid expansion and what lies ahead. Kate oversees all Medicaid programming at CPS and has more than 20 years of experience in public policy in various disciplines at the state and local level, and we're so thrilled that she can join us today. Following Kate's presentation, we'll have a panel discussion with representatives from several school districts getting started in expanding their school Medicaid program. Laura DeStigter will be moderating our panel discussion. Laura has extensive experience in public health and school health and has served as the project director for Healthy Schools Campaign's Medicaid Expansion for School Health Initiative for the past 2 years. But first, I'll provide a little background for our discussion today. For those of you who are not familiar with HSC or Healthy Schools Campaign, we are a national organization working at the intersection of education, health, and equity. We are based in Chicago, and we're a leader in advocating for sufficient and sustainable funding for school health services, including through Medicaid. School health services are critical to advancing equity, improving access to health and wellness, and reducing the barriers to healthcare many students and their families face. School-based health services can allow for early identification and intervention of health issues, and they are linked to better health and academic outcomes to keep kids healthy and learning both in the short and long term. But there are different models of delivering health services in schools. Some schools may partner with community-based providers or host mobile vans. Some schools operate a school-based health center with a clinic located in or near a school. And some schools use telehealth as a modality to deliver school health services. But when we talk about the school Medicaid program, we're focused on providers who are employed by or contracted by the district to deliver services in a school setting. All models of delivering or financing services in schools are important, but our focus today will be on school-employed providers, and this is where Medicaid plays an especially unique role. At a high level, Medicaid is a health insurance program for 1 in 5 people in the United States. Medicaid, together with its sister program, the Children's Health Insurance Program, or CHIP, covers almost half of all children in the U.S. and guarantees children comprehensive coverage for all medically necessary services. A key feature of the Medicaid program is that the total cost of the program is split between federal Medicaid and states. And states have the flexibility to design their Medicaid program, and then CMS, or the Federal Centers for Medicare and Medicaid, must sign off on the program. Each state's Medicaid program is ever-changing, and each program is governed by a state plan, a written document that is approved by CMS. Changes to a state's Medicaid program are made through state plan amendments referred to as a SPA. Now, for over 30 years, Medicaid has paid for eligible school health services included in students' IEPs or individualized education programs or IFSPs, individualized family service plan. And while Medicaid spending on school-based health services represents a small fraction, less than 1% of total Medicaid spending, it's significant for schools. But historically, Medicaid would only reimburse schools for services provided to a limited number of students, those with IEPs. Then in 2014, CMS made a policy clarification that schools can be reimbursed for services provided to all Medicaid-enrolled students. So now all states have the option to receive reimbursement for services delivered to all Medicaid-enrolled students in schools. Medicaid can pay for school-based health services if the student is enrolled in Medicaid, services are covered by the state, services are delivered by a qualified provider, and states have all the appropriate billing and documentation and oversight mechanisms in place. But it's up to states to decide to expand, and this decision often involves different stakeholders, as we'll hear today. Once a state has decided to expand, it must look at its existing Medicaid state plan to determine how best to move forward. So now let's look at which states have taken up this option. This map represents all the states that have expanded their school-based Medicaid program. As I'll discuss in just a moment, this is really an exciting time to expand because of new support and investments at the federal level. So take a look at this map, and even if your state is not green, I'm sure there are people in your state considering this change. In the past few years, we've seen a significant increase in federal support and investments around school health services and the role that school Medicaid can play in advancing and sustaining services. COVID only elevated students' mental health needs and the role of health services in schools. And many states use their one-time COVID relief or ESSER dollars to invest in school health services and mental health services. But the biggest game changer, or a real game changer for school Medicaid, were some key provisions in the Bipartisan Safer Communities Act, which passed in June of 2022. The act stipulated that CMS issues needed updates and clarifications to its school Medicaid guidance for states. It also called for CMS to establish a technical assistance center and to issue grants to states to expand or strengthen their school Medicaid programs. And these grants are anticipated to roll out in 2024. So there's a lot of momentum for school Medicaid, and many states that have expanded are seeing the benefits and impact to their state. But there are also some challenges in this moment due to the unwinding of the Medicaid COVID provisions that protected coverage and ensured no one could lose their Medicaid during the public health emergency. Now, as that protection is lifted, millions of kids are losing or at risk of losing their Medicaid health insurance. So this is a pivotal moment to bolster Medicaid programs all around. So with these opportunities and challenges, we turn to Illinois, where roughly a third of all students are enrolled in Medicaid or CHIP, and where there are over 800 school districts. There's a lot going on, and I'm so excited to welcome Kate Yeager and have her share about Illinois' experience expanding school Medicaid and some lessons learned. Kate, thank you so much for joining us today.
Thanks, Jessie. Hi, everyone. As Jessie mentioned, I'm Kate Yeager. I'm the Medicaid Director at Chicago Public Schools. And in the next 20 minutes or so, I will give a very truncated version of everything that's happened in school Medicaid in Illinois over the last 4 to 5 years. So just kind of looking back at the timeline, where we are in implementation today, and then sort of lessons learned and recommendations for future school Medicaid work. Next slide, please. So as many of you know, Illinois took the route of very engaged advocacy in order to get the SPA done. It took 3 to 4 years. I think at some point we lost track of how much time had passed, but it was all worth it in the end. Part of this advocacy work it's really engaging with both the state Medicaid and education agencies, so Department of Healthcare and Family Services and ISB, talking with various LEAs across the state, talking with state school health organizations, various health service systems, providers, community partners, hospitals, a number of health and education nonprofit groups, different philanthropy and funding groups to help us along the way. And then a wide variety of elected officials across the state, including the governor's office. And as part of this, we developed a myriad of materials, 1-pagers, 2-pagers, short briefs, long briefs, geographic specific school Medicaid data, all really tailored to the different audiences above that we were engaging with, which I think is part of the reason we were successful in finally getting this done, is that we were able to really speak about the impact and ramifications of this to all of the different stakeholders. Next slide, please. So the LEA engagement piece was critical. I know a lot of you were engaged with this, but what we wanted to ensure was that we had a really diverse representation of districts across the state involved in this effort. So when I say diverse, we're really thinking about the district size, the Medicaid student population side in particular, whether or not districts had an existing Medicaid billing program, if it was in the maturity level of that program and robustness of that program, capturing urban, suburban, and rural districts, and making sure that we had general geographic representation across the state. I think we can all recognize that this expansion really impacted different types of districts in different ways. But at the end of the day, should mean more revenue and better representation of the school Medicaid billing program in our districts. Next slide, please. So this is a general timeline of what's transpired over the last couple of years. So I think advocacy for the SPA, particularly the free care piece of it, which is what drove this work, started around 2018-ish. So fast forwarding to September 2021, HFS finally submits the SPA to CMS for approval, retroactive to July 1st of 2021. As we all know, this ended up causing a lot of confusion over the last 2 years, but it got in at the end of the day. That retroactive piece is beneficial for increasing revenue. So for school year 21-22, the SPA is pending, but we're operating under certain conditions of the SPA. So a copy of the SPA has not been released. The provisions in the SPA have not been released yet. So districts were really going off what pieces the state decided to start implementing at the start of the school year. And really that information was distributed through trainings with SPA's state plan amendment. Sorry, I just saw that one question. So really getting our information from the trainings provided by Public Consulting Group, PCG, who is the state's Medicaid billing vendor. And essentially what was happening in school year 21-22, cost settlement, which was added into the SPA, was implemented, and we knew free care would be included under the retroactive billing. So in October 2021, HFS issues a program notice. This is different than a provider notice, which is sort of the official policy or program change. The program notice really provided a general overview of what was going to be in the SPA, and gave sort of a phased rollout timeline in there, but didn't really go into a lot of detail. And then in June 2022, we have the Bipartisan Safer Communities Act, which Jesse spoke to, but this really impacted the SPA timeline in Illinois. So typically we had been seeing SPAs across the country being approved in 6 months, 9 months, maybe a year, and our clock had been ticking, but really our SPA, and I think there were 3 or 4 other states had their SPAs kind of held, essentially to ensure that whatever changes CMS included in their updated school Medicaid guidelines were included in our SPA already, so that Illinois did not have to submit another one and go through the process again to ensure that we were compliant with any new policy changes from CMS. So that explains essentially the delay in our SPA being approved, which happened finally in April of 2023. Next slide, please. So what was in the SPA? So as we mentioned, it reverses the free care rule, moves from a rate settlement methodology on the administrative side of things to a cost settlement reimbursement methodology. And it implemented a number of changes to the random moment time study, or RMTS, process. And most of those changes were sort of phased in, I think, over the last year and a half, piece by piece. And there were a couple other changes, changes to specialized transportation billing, and other pieces, but these are sort of the three key pieces. Next slide, please. So the free care rule expansion. So Jesse mentioned, this expanded reimbursement eligibility from IEP, IFSP students only, to any Medicaid enrolled student for any allowable service provided by any eligible provider. So this, there's the alert, everyone. It's 2 minutes early by my clock. I was watching, but okay, sorry about that. Okay, so expands to IEP, IFSP, 504, any other type of individualized plan of care, or essentially where medical necessity has been established by a licensed health provider. As part of this, and this added a little bit to the, sorry, Nina, it scared me too. I will not watch the recording of this to see my face. So as was required by IDEA for special education students with an IEP or IFSP, a one-time parental consent to bill Medicaid was added to be required for the gen ed population as well. As for eligible service providers, so it expanded the list of providers eligible. It also tweaked the language to make it easier in the future to add additional providers and better reflect what's happening in schools. You'll see the list there of the 5 new provider types. So licensed clinical professional counselor, marriage and family therapist, orientation and mobility specialist, licensed clinical psychologist, and RBTs. I think that, just 1 second, but that was great. I think the one thing to note with free care versus the next 2 pieces we'll talk about is that free care is the optional piece that was included in the SPA. So there was no requirement for districts to start billing for these additional students, additional providers. This is just an opportunity for districts to obtain additional reimbursement. What also got added into the SPA with cost settlement and RMTS are required changes. And I'll talk a little bit how that impacted implementation in just a minute. Next slide. Okay, so cost settlement, I won't spend too much time on this. This is really an administrative change. So this doesn't impact our school providers or our students. It's really the finance office and those of us submitting the billing and claiming information. So the state moved from a rate settlement methodology to a cost settlement methodology. I'm not quite sure what the updated number is, but I think there's at least 20 some odd states that are currently using cost settlement. And this is typically the methodology that's used by hospitals and other health service providers in the country. So it still calculates the true cost of the provision of services to a district, but it essentially does a better job of it, 1, and 2, streamlines the process for both LEAs and for HFS. So it should result in faster payments to districts from the state, and it should result for 99.9% of districts an increase in revenue received each year. So for the next couple of years, while we're still receiving those 2, 3, 4 year delayed rate settlement payments, there's going to be a little bit of overlap because we'll start receiving our cost settlement payments for those current years. So I think for about 2 or 3 years, we'll be getting the super late payments for rate settlement, and then the new payments for cost settlement. And then in a couple years, it will just be those cost settlement payments moving forward. As part of cost settlement, and this was a big change, all service providers must be included in RMTS in order to claim fee-for-service or administrative claiming. So previously, you could bill fee-for-service payments for a provider without including them in RMTS. That is no longer the case. Anyone that you are seeking any type of reimbursement for must be included in RMTS. Next slide, please. So RMTS update. So again, all service providers, all administrative staff, anyone that you're seeking reimbursement for costs must be included in RMTS. So some of the notable changes that, as I mentioned, were phased in. Hearing vision technicians were added last year to RMTS. Those were previously calculated in a separate manner. And ISB licensed counselors who are providing mental health services were also added to RMTS. The second part of this, which started this school year, and I know we have all been grappling with meeting this requirement, but essentially every day that students and staff are in school, that day must be included in the RMTS period. So essentially what that did for us is, instead of starting October 1st of this year for the first quarter of RMTS, it started our first day of school, or the first day that staff were back in school, the week or two before school started. So this, again, was something we learned about over the last year, not right away. So I know CPS, we were scrambling is the wrong word, but it was a whole lot more work to get that in on time and update it over the last 6 weeks, as a lot more hiring was done. I think on the summer RMTS, the summertime study, it is noted in the SPA. I think it's TBD if that will actually be happening, and that's all I really know about that. So next slide, please. So implementation. So the initial challenges, as I mentioned, was sort of the abrupt shift in direction. We had focused on free care and the expansion for so many years, and then cost settlement, some additional changes to RMTS were added. And as I mentioned, those were required changes that required immediate compliance, versus free care, which is that optional opportunity for the district. So we may all agree that I think this caused a lot of confusion at the onset. There was a general lack of understanding around what cost settlement was, what its impact would be on LEAs, what was required, what was not. So I think we're in year 2 now of cost settlement. So I think that piece where that process has smoothed out, but I know that caused a lot of confusion at the initial SPA approval and submission. Okay, next slide. So where are we now? So this year, adjusting to the extended RMTS window. As I mentioned, the second year of cost settlement, ensuring staff pool lists are up to date, especially with the extended first quarter window. Exploring and implementing free care expansion, ensuring that we have all the Medicaid compliant documentation for the gen ed population, and then staying abreast of all of the changes that are happening at the federal level with the SPA, as Jesse mentioned, with the unwinding of continuous enrollment, with the PHE ending, and the CMS guideline updates. And then I think, yeah, we're still just all looking for more information. I know the state is working on updating our own administrative guidelines to reflect the changes in the SPA. So we are anxiously awaiting that to come out, I think. Next slide. And then, so just to sum up kind of what we learned over these last few years is, advocacy was not the easiest path, and it certainly wasn't the intended path, but I think the end result was extremely beneficial. We had a lot more districts and a lot more stakeholders who were better educated and better informed and aware of what these changes were and what they meant for districts. Also, the adjusting and adapting. Anytime you open up the Medicaid state plan, you open up the possibility of the state adding additional changes into that, and Illinois certainly experienced and saw that. I think collaboration between the state agencies, so HFS and ISB, is critical, that they're working together and disseminating information to all of the districts across the state. I know that we are all very thirsty for information and appreciate the opportunity to provide feedback and also communicate additional needs for implementation and for school Medicaid in general. I think next slide, I know I'm about at time. So recommendations, really, and this is, we're thankful for HSC, but it makes us able to leverage what other states and other LEAs are experiencing and learn from them. Again, having HFS and ISB take the time to understand the needs of LEAs, understanding not just implementation of the SPA and free care and everything else, but really for future program improvements, communication. And I think an ongoing thing is just keeping that shared learning space for all of us to discuss, how things are going, our challenges, our successes, and learning from each other. So I think that is it. So let me know if I missed anything, Jesse.
Thank you so much, Kate. We really appreciate that great presentation. So we've heard now what's been happening at a very high level in Illinois, and now we're going to take a look at our work with school districts in the state and hear directly from folks on the ground who are working to improve and expand their school Medicaid program. So our school district panelists today have been participating in Healthy Schools campaign's Medicaid Expansion for School Health Learning Collaborative, which is known as MESH. This was launched in 2021 in response to Illinois submitting its state plan amendment to CMS. And the project was designed to prepare school districts to take advantage of the changes in the SPA by building their capacity to expand Medicaid billing to all Medicaid-enrolled students, maximize their Medicaid reimbursement, and leverage the funds to address the physical and mental health needs of their students. Our participating districts formed a team consisting of staff members from school health services and/or behavioral health, special education, finance, and district administration. And teams were guided through a process of assessing their district's Medicaid billing and health services, developing and implementing an action plan to address those gaps. We had 8 teams in our first year of the project, which ran from October 2021 through May 2022. And then 14 new teams joined us in the second year, which ran the school year of 2022 to 2023. And as part of the MESH project, we developed really a visual snapshot of the Illinois school Medicaid reimbursement process with steps divided up by role. And then in collaboration with our partners, we created guidance documents for each of these steps. And we use this as a framework for our training sessions. So we'll share the link to this at the end of the presentation. And we recognize, and it's reflected here, that there is a lot that goes into building a robust school Medicaid infrastructure. And we know folks in districts are very busy. So we really encouraged our districts to assess which steps in this process flow they needed to work on and tackle this a little bit at a time. So our panelists today are going to share their experience working to strengthen school Medicaid in their district and the initial steps that they took to take advantage of the opportunities that have been opened up by our Illinois SPA. So without any further ado, I am pleased to introduce our panelists. Heidi Hopkins unfortunately had a family emergency, so she is only here with us in spirit today. She did send me some notes, so I may call out a few points from her. I know I can't do justice to the amazing work that they have done in their district, but I might try to call out a couple of things from Ball Chatham. And then we have with us Meredith Teamer. She is the claims reporter and analyst for Evanston-Skokie School District 65. They're located just north of Chicago, for those who are not familiar with our state. And they serve about 6,500 students in pre-K through 8th grade. And then with us from Sandwich, we have Crystal Swan-Gravatt, Director of Special Education, along with Lauren Hoyt and Lindsay Brummel, who are school nurses in the district. Sandwich is about 60 miles west of Chicago, and they serve approximately 1,800 students. Thank you all for being here with us today. And I wanted to start by just having you each tell us a little bit about your role in school Medicaid in your district and who else in your district you've engaged in this work. So Meredith, why don't you kick us off?
Okay, good afternoon, everyone. So in my position, I handle all of our Medicaid billing, reporting, and special education reporting to the state of Illinois, as well as I handle all of our SPED-related internal audits. Who I work closely with that I really navigated more toward after being a part of the Healthy Schools Campaign cohort, second cohort, was with our McKinney-Vento liaisons, as well as our pertinent like school social workers and individualized service coordinators that are like hands on the ground in our schools.
Thanks so much, Meredith. And our team from Sandwich, you can introduce yourselves and talk a little bit about who you've engaged in this work.
I'm Lindsay Brummel. I'm one of the school nurses here. And for us, this started with our director, Miss Crystal Swan-Gravatt, who's with us today. So she kind of led the charge on this, and my coworker, Lauren, and I joined her in starting with the training. And it's gone really well. And we will then take it to our other nurses, and we're going to be the ones kind of leading the charge as far as training our paraprofessionals and everyone else getting them on board.
Great, thank you. So tell us all a little bit about the initial steps that you took to prepare for expanding your district's Medicaid program beyond IEP services. And Sandwich, why don't you guys start for this one?
Thank you. So we just took that flow map step by step that Healthy Schools created. Each bubble had a corresponding document, guidance document that we read through. For example, the obtaining consent to bill Medicaid, that resulted in us adding consent forms to registration. So we just tried to take that flow map and look at it step by step. And then we also created tip sheets for each specific role within our district. And that would include like reminders of the documentation of medical necessity, all the way through the how to respond to RMTS.
That's great. Thank you. I love that you created those tip sheets by role. Those job aids are so helpful for folks because it is a lot of new information for some. Meredith, you want to talk a little bit about your first steps?
Sure. We pretty much followed that guideline like Sandwich did, starting off. And then where we saw area of need was really thoroughly explaining Medicaid expansion to our stakeholders and to our school leadership, just to get their buy-in. And then after working with them, really thoroughly training specifically our paraprofessionals and nurses about like logging and things of that sort and what that will look like. And then after that, really connecting and working with one of our stronger social workers that like really has ties to the community, that was able to link me to the community to start discussing what unwinding would look like to support our families when they experience or if they experience that.
Thanks, Meredith. That's great. So lots of sort of communication work and training, getting folks up to speed, getting that buy-in to start. I'll also just share from Heidi's notes that she sent over to me. One of the things that they started with was just doing needs assessment. So they actually created a Google sheet to really look at their current situation and where they thought they could make the biggest change after the SPA was implemented, and where they saw potential challenges so they could hone in on where they wanted to start, because they recognized they had pretty limited capacity. So they used that to guide their first steps. So Meredith, can you share with us a challenge that you have encountered in implementing Medicaid expansion and how you've addressed that in your district?
Sure. So I wouldn't actually call it a challenge when I thought about this question. I wanted more like call it an area of growth for our district that we needed to work on. And that was definitely Healthy Schools campaign toward the end of our cohort really explained the importance of like internal audits with logging and processes, like because this was new to our district. So really working on a schedule with internal audits, especially around our logging for our support staff. And so me taking on the role of monitoring with our Medicaid vendor to make sure that logging was happening, because I knew that if we were going to expand, that we've got to get our kiddos with the IEPs going good to expand to those kiddos that are just Medicaid eligible. And then providing more training around random moment and time study. That was just, and that's going to be an ongoing thing. And so we created a video and slides for even new staff, because it seems like we missed a lot of new staff that was starting in the middle of the school year. So making sure that they had resources in real time within 2 weeks of them being hired, that we were explaining random moment and time study. So when they got that email, it wasn't a surprise for them.
That's great. Can I ask a quick follow-up question? Did you encounter any resistance with the idea of kind of those internal audits? Did people get a little bit nervous about that? Or I know you're so great with communication, so maybe talk through how you address that.
Sure. So the way I addressed it last school year, and just for full transparency, so everybody can know, I was new to the district and new to Medicaid expansion. So I was juggling both parts of it. So we have a really great Medicaid vendor. And so they send alert emails, but it goes to me and to our staff. So I would send those kind emails to say, hey, your logging has a very low percentage. You have 15 days, because unfortunately everyone's busy in the schools. So a lot of logging would wait to the end of the school year. And of course that hurts our percentages and things of that sort. So I didn't really have pushback. It just, I had to be more explain like how their logging really affects our funding. And once I was able to break that down and say, like, if we have a higher percentage, it may not, and I was very transparent, it may not equate to a more larger salary, but it could equate to maybe more time for lunch or something like that, because we have staff funding through staff. And once I sort of broke it down, and then I gave them beginning of this school year an actual schedule of when I would be doing audits. So I'm doing audits November, try to do it quarterly, but November of this year, and then February of next year, and then May of next year, to keep on track with that logging. And, people were very appreciative that I gave them a time frame of when I would be doing certain things. So just getting that buy-in.
That's great. Thanks so much, Meredith. And yeah, it's good to know that when people see that connection, they have that that willingness to do what they need to do to keep this program growing. Sandwich, can you tell us about some challenge or two that you've encountered with Medicaid expansion and how you've addressed that?
Sure. So I think time is always a challenge, especially with our health aid paraprofessional role. Dedicated time to train and implement and maintain the expansion. So we're just being kind of creative right now and meeting with the teams to better understand their daily workflow and how we can use the resources that we have available to make sure that they have appropriate time to get things done.
That's great. I love that you're bringing in the staff that are doing this so you can understand their needs and really tailor it so that it's going to work for them. And that's such a key thing for building out a successful program. I'll share from Heidi at Ball Chatham too, that the biggest challenge they were facing was that their general education staff, really unlike special ed, they didn't have the experience or the background with Medicaid documentation at all. So that's something that they really wanted to work on and spent a lot of time doing staff training with the gen ed staff to get them ready for this rollout. And she created a new tracking system and just did a lot of communication similar to what we've heard already, just around the importance of this change and why this matters for the school district. Okay, so I'll start with you on this one, Sandwich. Can you share a success or two that you have had so far?
Yes, absolutely. I think that we all agree that our biggest success to date is getting that support, that much needed support from our stakeholders. So that for us would mainly include our admin team and our Board of Education, who's been very supportive and interested in this initiative that we have. And then that's just leading the way for all the smaller celebrations that we're getting as we go along. So that's our big one.
Hear. And Meredith, how about in your district?
Sure. So for my district, I was able to identify that, Medicaid expansion can really enhance and help with our 504 students. And our nursing team, they provide the most services right now to our 504 students for our medical necessity kids. And so I guess one of our wins is really having some good training over the summer for our nurses on the logging and explaining to them the importance of their role with this, and they're sort of our test department to see how this is going to affect us this year. And so really thanking them for it, and they are really excited about it and about the potential. So that was definitely a win for us.
Great. I would like you to speak a little bit to the benefits of this work to your district. So where have you seen the value for your district, for health services, and for your students? And we'll go back to Sandwich to start this one.
We have had a lot of benefit to just learning more, improving what we already, have been doing. So by really taking a microscope to how we bill for Medicaid, really understanding the new cost settlement, how important that staff pool is, how important the random moment time study answers are, and that they're applicable and pertinent to, whatever a person's doing at that particular snapshot time of day, and they're not just putting that they're at lunch, right? Because they don't want to fill it out. So just making sure that we have, we're improving upon, just like Meredith said, we're improving upon what we already know to do. But going forward, we see the benefits primarily center around mental health. We already provide a great deal of intervention and or direct services from, health providers, social workers, our school nurses, and our school counselors. They're all seeing kids face to face every day, providing something for a student with a health plan or a 504 plan or an intervention plan. And those kids happen to be Medicaid eligible. So we're finding that, now we're able to capture some, some funds to help us, continue to do that work. It's really about continuing that work here at Sandwich. Like a lot of districts, we, took on a lot more providers during the NICE ESSER funds, but we all know those are going to sunset and we won't have those funds. But this is an opportunity to make improvements, going with this expansion, billing and or improving upon our random moment time study, adding our school counselors to the mix. Our paraprofessionals, that was quite a challenge. Once for the staff poll purposes, a random moment time study, honestly, because they're the ones that's pulled most of the time because they're the largest group that we have that are providing direct services. So, the benefit though is everyone being educated about Medicaid, why it's important, why they have to pay attention to it. And our hope is that one, we get to keep the services that we currently have, and we would like to expand. My hope is that we get really good at this and we can bring on a clinical person, whether it be a LPC or a licensed clinical social worker that can actually provide clinical services for our children in our school setting. Because we live in the southeast corner of a very large county where all of most of our mental health services are provided at the county seat. That's a 35 minute drive for most of our families. So being a rural school, and I know many on the call will relate to this, having access to mental health services in a rural setting is very, very difficult. And for many members, in our community and especially our children. So that is my hope. That was the hope, reason why we joined MESH. I wanted to learn more. I wanted to, get out in front of it. And hopefully it'll pay off. We're betting that it will. And we have a long way to go, but I think we have a good start.
Thanks so much. So much of what you said, I think, will really resonate with folks, and just I do agree the mental health piece it's so needed, and it's such a big win from this expansion opportunity. Meredith, share with us what the big value has been for your district from doing this work.
Yes, what Crystal shared is a lot of, to add more quality services to our students. We have good quality services, but a lot of times our SLPs and OTs, they are spread thin across a few of our schools. So we would like to hire more so they could possibly be in the schools where one is designated to just a school or maybe two, but they are spread out across maybe 3 or 4 schools, which can affect services provided to the students, meaning in a timely manner because of their schedules. We are a little different in Evanston because we are so close to Chicago metro area where we would like to provide more services to our community as a whole. We have a new school being built right now to service a community that typically has to travel far to get to their local school. So we are building a school. It's considered our 5th ward school right now to service families in that area. So it will open around the time where we'll really start seeing the effects of our funding through Medicaid expansion. And so the hopes is to really utilize those dollars to not only enhance just that school, but also to be able to spread that funding around to all of our schools to provide not just more quality services around mental health or SPED, but even community and extracurricular, because getting kids that have, experienced trauma, getting them in sports and things of that sort, where they wouldn't be able to because we didn't have the funding to provide it. We want to really think outside the box on how those funds are spent.
I love that connection to your community, Meredith, and just that expansive thinking about what health and well-being and mental health are and how you can support those things in your district. That's amazing. So and for this one, what advice do you have for other districts that are considering expanding Medicaid billing?
So this is my favorite question, just because, like I said, I was so new to everything last year, and I know current states that are new to this, I would say really hone in on what you're already doing right, because Medicaid expansion is a daunting task, but it's a really great task. So enhance on what you can control. Meaning, like for me coming in a new role, I really wanted to make sure that I provided our Medicaid vendor and our states my reporting timely. So like that I wasn't so overwhelmed with worrying about reports where I was not planning for Medicaid expansion. So if you can, make sure you stay on top of your reporting that you're already doing so that you can give some time in your schedule to really sort of dive deep in Medicaid expansion. And I will say Healthy Schools Campaign and CMS, they have really good webinars and platforms like this where you can ask these questions. CMS, you really, in their webinars, you don't really have, it's a little bit more formal, but they provide you with really great information as well as like handouts that you can take to your stakeholders and say, like, this is not a me thing. This is like CMS saying this. And I've noticed that being able to participate in those webinars has really been helpful for me to explain how this is going to look, even with unwinding, because explaining unwinding to our superintendent, they're like, well, how does that affect the district? I'm like, well, eventually our families are going to ask the schools, what is unwinding? And we have to be prepared to at least give them a warm handoff to someone to help them. So I would say get in touch with your community, work with your stakeholders, go to those webinars. I know we're all busy, but try to multitask while listening to those webinars, because there's some good tidbits in there, as well as really staying on top of your reporting that you're already doing so you won't become so overwhelmed. And lastly, the action plan that Healthy Schools gave us, it was amazing because it just sort of helped you stay on track and realize that you can just take this step by step and don't try to do everything all at once.
Thanks so much, Meredith. That's great advice. Sandwich team, what's your advice to districts that are just thinking about starting out with expansion?
Well, first and foremost, we have lots of experts around us and that we're very thankful for. One, MESH, just having the opportunity to, build that action plan, to learn more about it, to ask those questions and to participate in those, those, what were they, monthly, weekly, webinars, and or, when we would all come together and talk about our action plans. So from those action plans, or the action plan that we wrote, we began to implement some of those changes. And we couldn't have done it without our billing vendor. We couldn't have done it without the assistance from the Illinois Alliance of Administrators of Special Education, IAASC. They have a Medicaid committee. That is the big Illinois association for special education directors, special education administrators. So we used every available resource we had. I attended every breakout session I tried to just arm myself with the knowledge so that I could ask an intelligent question, or I'd hear how someone else did something. So that was great. Again, from our action plan, the first hurdle that we wanted to overcome was that doggone consent for Medicaid, right? That consent. We were able to work with we had to move to a new student management system this year. And so we were able to get that vendor to enable us to get Medicaid consent right upon enrollment. So it's a question that the parents or guardians are given right upon enrollment, digital enrollment, online enrollment. And so we have that, that Goliath, that we have that one figured out. It really helps us to move forward quickly. The tools you all gave us through MESH were great. That flow map as that guiding document, it was very helpful, and it was a great training tool for all of our providers, all of our individuals that were bringing on new, right? That were bringing on new to help get this going and teach them more about Medicaid. It's a great document. And also just, there's so many benefits to really putting forth the effort and the time. It definitely is for a small rural school where you wear lots of hats. And again, I know many people out there are in my shoes or in our shoes where you do more than just one thing. So you are the business office, you are the CNI director, you are the grant manager. You have to learn it all because you are small but we are nimble. So rural schools can do things more quickly. Smaller districts, because they are more nimble. There's less bureaucracy, there's less red tape. As long as the individuals that are given the authority or ability to move forward, that's not so bad being a small school when it comes to things like this. So embrace it, and use your resources. They're available, and there's some really good ones out there.
Thank you so much for all those great insights. We really appreciate the amazing work you have done in your districts and your commitment to improving supports for students in your districts. And I am going to pull the slides back up and hand it back over to Jessie to wrap us up.
Thank you all so much, just for that incredible panel and for the great discussion. It was really fantastic, and just appreciate everything you all shared. I'm going to quickly wrap up, and I know we have a number of questions. We will follow up after the webinar individually with some questions, and we can also share them on our page that we'll be sharing out after this webinar. But I just wanted to highlight a few key takeaways that we heard today for states, for school districts, and really for all stakeholders. First, as we mentioned at the very beginning, this is such an important moment for states to expand and to innovate and advance your program. And states are starting to see the benefits. And Illinois State Plan is really a model for other states in that it provides a broad and comprehensive foundation to build off of and improve student health services and outcomes. In addition, as we heard, it's so important to assess the needs of your LEA before starting out and connect with other LEAs in other states and talk with one another. And we also heard about the importance of just engaging and coordinating with state Medicaid and state education agencies and working with them to create a shared learning space to discuss implementation challenges, successes, and recommendations. And finally, I want to highlight just the importance of also aligning with other school health initiatives so that we can really work together with other efforts happening within a state to realize the full potential of this sustainable funding source. I know there were a lot of questions about resources. Next slide, please. A lot of questions about resources, and we'll share these after the webinar, but these are some resources that can take advantage of and use that hopefully will help you in your district and as you move forward at your school. And then finally, this is my contact information. Thanks for dropping those in the chat. Thanks. And I just also want to say such a huge thank you once again to Kate Yeager, to Laura DeStigter, to our incredible panelists for everything you shared, and to really everyone that participated in the Medicaid Expansion for School Health project. And we also had an incredible advisory board. So this really was a team effort, and we're so grateful to everyone that shared and continues to keep things moving forward. So again, I know we're at time, but we look forward to following up with you all and answering some of the questions that we see coming in and sharing more information to help you explore options and move this important policy forward in your state and continue to transform your school Medicaid program. Thank you all so much again for joining us for this hour, for staying with us through the FEMA emergency alert system. And we look forward to being in touch following this webinar. Thanks, everyone. Have a great day.